Thank you. Thanks for coming, everybody. It's nice to come out and talk about rheumatology. I'm keeping it really basic and talking really about what I do and what a rheumatologist is, and a lot of questions that I'm asked almost every day in practice. So hopefully it will shed a little bit more light. But afterwards, if you have other questions about rheumatologic issues, I'd be happy to answer, things that I don't cover today. But it's sort of a mishmash of rheumatology issues that I usually talk about. So first of all, what is a rheumatologist? So the definition is derived from a Greek term, to flow like a river. So we would hope that everybody's moving like a river and flowing nicely. So that's the origin of the word, but it's a subspecialty of internal medicine. So I did a residency in internal medicine and then a fellowship in rheumatology for a couple of years after that. And basically what we specialize in is arthritis and autoimmune diseases. So that's our focus. And a lot of times I'm asked, what is an autoimmune disease? This is an abnormality in your immune system, which normally is used to fight infections. Could be any sort of infection, bacteria or viruses. But what happens is your body's immune system turns on itself and reacts against your body's tissues instead of doing its job in fighting infections like it should be doing. So this results in inflammation or irritation. A lot of our words have the word term itis after it, meaning irritated or inflamed. And a classic example of a disease that's an autoimmune disease is lupus. So you may have heard of lupus before. So this is a disease that has a very broad spectrum of issues that are associated with it. It can affect almost any system in the body, from the kidneys to the lungs to the joints. So it's a very interesting and concerning disease to have. And so other types of diseases that we see, one would be just osteoarthritis, wear and tear arthritis. We see the non-surgical side. We don't go to the operating room like Dr. McGovern here. So we see gout. Gout is a type of arthritis caused by crystals that deposit in the joints. So there are a couple of different kinds of crystal-related arthritis. Rheumatoid arthritis is a big one. This is more of an inflammatory arthritis that I'll talk a little bit about. Psoriasis and psoriasis-related arthritis. We see osteoporosis cases, so thinning of the bones. Lupus I talked about, and some more of the rare diseases I have listed on the right. We like a mystery. That's generally, if you talk to a rheumatologist, we like the mysteries. We're often asked to see cases that we really don't know what's going on. Can you help us figure it out? One of the types of cases would be something called a fever of unknown origin, meaning somebody has a fever and we don't know why. So it can be caused by more than just, your usual cold. It could be an inflammatory condition like one of the ones that we see. So in general, what is arthritis? It really means a joint is irritated. It's having pain or dysfunction. And a joint is where two or bones join together to form a mobile joint. There are many different types of arthritis, so it's kind of a broad blanket term to say arthritis. And the most common form that affects most of us in life is osteoarthritis, which is more of a wear and tear arthritis. It usually attacks the fingers, the knees, hips, and spine. So more of the things that we use most often, the fingers and the weight-bearing areas. It's a little bit more unusual to have osteoarthritis in other locations, such as ankles and other joints in other locations. But still could happen if you've had an injury, say, to the ankle. You may end up with more of a wear and tear arthritis in that joint later in life. We have lots of treatments, but nothing that reverses it. We can't cure it. It's like the common cold of of medicine. We don't have the cure. We have things that help significantly. So medicines, pain medicines, injections, exercise and weight loss. That's a big thing that helps us a lot with osteoarthritis. And then, ultimately at the end of the spectrum would be joint replacement surgery when the joint space is lost. And I don't think I have a arrow. Oh, I guess I could use this. So this is a normal joint here with the cartilage lining the bone and what tissue we call the synovium, which is a lining of cells that goes around the joint. This is healthy and happy, and then later we could have loss of this cartilage and bone spurs forming and fragments of cartilage breaking off inside the joint. So it can be very painful, and hopefully there's something that we can do to help interfere with some of the pain and discomfort that osteoarthritis causes. A question I get a lot is exercise safe? And generally, and speaking about arthritis and even any type of arthritis, gout, rheumatoid arthritis, yes, always exercise is a good idea. Keeping the joints mobile will help them preserve your activity level, help with your flexibility. So there are different types of exercises that help with your range of motion, stretching, yoga, strengthening exercises are a great idea. And aerobic exercise is helpful in terms of weight loss and staying active. I often recommend pool exercises if you're a fan of the water. It helps take away the weight and helps you move freely in the water. So that's a nice option if you can have access to the pool. Another question I get often is, do I use heat or do I use ice? And so generally what I tell people is that for chronic pain that you've had for a long time, try heat. Usually it feels good to have heat in that situation. If it's a sudden onset of pain in a red and warm, swollen joint that's been injured, for example, then we say try ice. But it's not set in stone, so I think it's not going to hurt you to try heat for an acute situation or ice for a chronic situation. You could try both and see what helps. So that would be what I would say about that. Another question I get often is, should I take supplements? There are several out there. I hear about new ones every day, I think. One that's been studied relatively frequently is fish oil. I think you could go either way. It's not a definite, proven, reversible. It's not going to change your arthritis completely, but it's not going to cause harm. So if you wanted to try fish oil for wear and tear arthritis, this would be fine. Turmeric is the yellow spice often seen in Indian foods. There have been a couple of studies showing that it may be beneficial for inflammation. So it might be worth a try. It shouldn't be harmful. Glucosamine chondroitin is one out there quite frequently. The studies really don't have a lot of power behind them showing that they really do a whole lot. I usually tell people if you want to try it, that's okay. I think the only situation which I've heard of recently is that it could potentially worsen glaucoma. So that would be a situation in which I would avoid a supplement like glucosamine if you have any issues with glaucoma. Otherwise, I've had people say it helps them quite a bit. So anecdotally, it might be helpful. It might not be too bad to try. Another question I have frequently is, can a special diet help my arthritis? And there's a big fad out there now, I think, on gluten-free diets. I have that question quite a bit. I don't think or know of that there will ever be a study that follows populations of people doing a strict gluten-free diet so that we would know. I've had people tell me that it helps quite a bit, but I don't know that I could say with any certainty that it's something that you should do. If it's something that you wanted to take on, I don't think it will be harmful. But I'd rather see if you had a cardiac heart condition or another condition that needs to have a special diet, that's probably the preferable thing to protect would be your heart over trying one of these diets that's not proven. Medications. What medication should I take for my pain? There are several over-the-counter medicines out there, and it can be confusing to understand the difference between Tylenol or ibuprofen, Advil or Aleve. All of these are available with ease, but not necessarily safe to take, even though they're over-the-counter. So I would say if you take any of these medicines with any frequency, I would ask your doctor. For example, if you do have any history of cardiac disease or strokes, medicines like ibuprofen, Advil, Aleve, if you took those every day, they have a higher chance for increasing cardiovascular events like heart attacks and strokes. So also a lot of patients with these issues may be on blood thinners, and medicines like Advil, Aleve, ibuprofen don't mix with blood thinners. So in those situations, Tylenol would be safest. Tylenol has a bad rap sometimes in the press in relation to liver toxicity issues. I would say if you don't have any pre-existing liver problems and you're taking it well into the as prescribed range, which usually we would say less than 3,000 milligrams in a day. Most people are taking 1 or 2 here or there. You're not going to run into problems in general with a liver toxicity in these scenarios. So then there are lots of topical creams that can be tried. There is something called capsaicin cream, which is derived from a hot chili pepper. I haven't actually purchased this and tried it myself, but most people say that it burns. So I should do the experiment myself. But that is, under the American College of Rheumatology, one of the recommendations for folks that can't take the other anti-inflammatories like Advil or Aleve. So if in doubt, I would talk it over with your doctor, primary care doctor or otherwise. And then another question I have a lot is, what's the difference between rheumatoid arthritis and osteoarthritis? And do I have rheumatoid arthritis? So I should have made a nice table where I could connect these two here, but rheumatoid arthritis, we consider it to be an inflammatory arthritis. It's an autoimmune disease. It's your body's attacking your joints. Whereas osteoarthritis is more of a wear and tear over time process. Rheumatoid affects about 2 million Americans, osteoarthritis 27 million Americans. So there's a bit of a difference there, but still relatively common for an autoimmune disease. Rheumatoid arthritis is one of the most common autoimmune diseases. Rheumatoid can occur at any age. Even young children can get something called juvenile inflammatory arthritis, which is like rheumatoid. Whereas osteoarthritis, your biggest risk factor really is getting older. And then rheumatoid can cause damage to tissues outside of the joints. So it could cause trouble with other things like lungs, your eyes, your skin. We see a variety of other issues related to rheumatoid. And here's an example of the inflammation that we see. We have the regular joint, I'm having trouble with my arrow here, the regular joint on the far left, which we saw a little bit of earlier with a nice cartilage in between and a nice lining along the side here. Then with rheumatoid arthritis, we get lots of swelling. The cartilage and the bone itself gets eroded. We see erosions in the bone. And we lose the joint space in that way, and that is it's a very destructive type of arthritis. And then this is more of the osteoarthritic joint, where you've lost that cartilage space and you have more of the bone formation or bone spurs instead around the joint. So if you're looking at hands, the difference between the two, I have rheumatoid arthritis here on the left, and it's affecting the bigger knuckles up closer to your wrist. usually. We see a lot of swelling in those joints. And you can see how the fingers will sort of turn to the outside eventually. This is in somebody who's had an active rheumatoid arthritis, who's getting active deformities in this case. And then on the right, we have a osteoarthritis. So these are the far away joints, the two furthest away joints. And we have special names for the nodes that form here. Heberdin's and Bouchard's nodes, fancy names. But this is more, you can see the difference here. These get knobby. Sometimes they can get a little bit irritated and inflamed and actually look swollen before they calm down and get the bump, the bony bump there. Osteoarthritis, we say it's not inflammatory, but we don't understand it completely yet. We're working on it. There is a component of inflammation, so that's not the whole truth, that osteo is not inflammatory. So those are the differences, at least in somebody's hands. And then I don't know if you knew, the painter Pierre-Auguste Renoir had rheumatoid arthritis. And towards the end of his career, he had to tape his paintbrush to his hands so that he could paint. And you can see the deformities in his fingers. I wish I had a picture of some of his earlier works compared with his later, but you can see a difference in how he was able to paint because of his disease. He apparently died of complications, so he had other organs involved with his rheumatoid arthritis. And back then, we didn't have treatments like we do now. And I'm sure if you watch TV these days, you will see several commercials for arthritis treatments. Many are out there, and the side effects will scare you to death if you listen to the commercial. The good news about these medicines is that they prevent these deformities from happening in most cases. So we're able to really prevent this stage from happening now. So rheumatoid is really a disease that we can induce remission with medicine and prevent this from happening. So I tell people who have this diagnosis, that's good news. And it's bad news. The bad news is that you have rheumatoid, but the good news is that we actually have several medicines that help intervene on the arthritis to help prevent it from advancing. Whereas with wear and tear arthritis, we just don't have that necessarily. We have things that help you with pain. And we have Dr. McGovern. And then, thank you, everybody. So these are my kids.